Proper communication skills are essential for effective doctor-patient interactions and in achieving greater patient satisfaction. In this roleplay, we will be implementing and highlighting elements of the medical interview. Rick Wayne is experiencing trouble urinating and has erectile dysfunction. Mr. Wayne and his wife Jane visit the nearest general hospital, hoping to get some answers as to what could possibly be causing his problems, and information regarding the recommended treatment.
Oh gosh, I really need to be here now. Why are you forcing me to come by the doctor for it?
You know exactly why you have to come by the doctor, so relax yourself and see him.
I tell you, everything working fine right now. It's just, the problem here is you.
Look, don't let me tell you what your problem is, eh? It's so embarrassing.
Relax yourself now, not in front of all these people. And this doctor taking so long, eh?
Hi, I'm Dr. Parker. So, what happened to you?
A woman doctor and she,
That's how you start the conversation?
Yes, I'm a woman. And hello, I'm the doctor here, okay? So, and I'm also really busy, so could you just hurry up and tell me what is your problem?
Well, Doc, you don't think we should go like in a private room or? Because my condition kind of sensitive now.
Sensitive? Nah, this is good. Don't worry about that. Plus, I have 20 patients to see after you, so, hurry up and keep it short and concise.
Well, I'm having some trouble with my,
Wait, tell the doctor what's going on.
trouble with my...
Oh, yeah, my problem is your penis.
Well, you don't have to advertise it to the world, you know.
Don't need to advertise your problems in bed, you know.
Listen, if you can handle the situation, you're really wasting my time, so I really want to see this.
I'm wasting your time? Hello, I have several other patients to see, okay? I don't have time to beat around the bush with your little problem.
My little problem? You know what? I demand to see a real doctor right now. This conversation is over.
Well, fine. Dude, that's complicated.
In scene 1, Dr. Parker fails to establish rapport with her patient. She does not greet him pleasantly and also does not attain his demographical information. In addition, her non-verbal communication portrayed that she was busy, uninterested, and felt as if her time was being wasted. Dr. Parker also did not invite Mr. Wayne to talk with her in a more private setting and did not take his complaints seriously. As a result, Mr. Wayne felt increasingly uncomfortable, insisting that he be seen by another doctor. In the following scene, a male doctor who is more experienced intervenes.
The Dr. Parker, she know a doctor and she fishes over. Woman again, waste of time.
What you saying about women again? You never like women in power.
That's because women don't know how to be in power. I hope the next doctor that come better than she.
Good morning, sir. My name is Dr. Johnson. Nice to meet you.
Nice to meet you.
I heard there was a problem between you and one of my interns. Is that right?
Yeah, she looked like she knew a good man. That's the problem.
Oh, so sorry to hear that. I would like to apologize on behalf of Dr. Parker. Can we proceed to take this in the office?
Alright, that sounds good.
Okay, can you have a seat for me, please?
Sure.
Okay, can I get your full name and age, please?
My name is Rick Wayne. I'm 47 years old, but you could call me Rick.
Okay, Rick. Can you tell me what brought you to come and see me today?
Well, I've been having some trouble with my
Why you get so quiet? Tell the doctor what happened.
With your...
penis.
Okay, excuse me, Miss Wayne, but can you leave the room for a few minutes for me, please? I would like to speak with Rick personally.
Okay.
Now, Rick, can you tell me a bit more about your problem?
Well, like I was saying, I was having some trouble with my penis, right? But like I've been having like erectile dysfunction,
Right.
and I've been having a little trouble passing urine. But this like happened in like around 2 months now. Well, when my wife does harass me about it, it's been kind of embarrassing, so I just don't really want to talk about it like in front of her.
Okay, so can you tell me a bit more about your problem urinating?
Like when I'm urinating, I've been having some slight pain when I pass in urine.
Okay, so in summary, you have trouble urinating and you have erectile dysfunction. Is that right?
Yeah, that's right.
Okay, so what we'll do next is I'll just ask you a few more questions, and then we'll decide if we need to examine you, and then we'll go from there. Is that okay?
Sure. Yeah, that's good.
Okay, so can you tell me on a scale of 1 to 10 how bad is your pain? With 10 being the worst.
Well, I would say like it's probably like around 4 or 5.
Okay, can you tell me, is there any blood in your urine, and how much is it?
Well, I've been having a little bit of blood in my urine, like a little bit.
What is a little bit? A teaspoon, tablespoon?
Well, I would say like roughly around like a teaspoon.
Okay, so Rick, I would need to take a digital rectal examination, and this examination just entails me examining your prostate. Ideally, for this examination, you would have to be undressed from the waist down, and you would have to turn on your side with your knees towards your chest. Then I would use my index finger and insert it into your back passage just to swipe around and see if there are any enlargements. Are you following so far?
Yeah, but I really have to do this because I don't really want to.
Well, Rick, I'm sorry to tell you, but it is necessary as it will help me to come up with a proper diagnosis. But at any point in time, if you feel uncomfortable, don't hesitate to let me know.
Well, alright, then I guess you could perform the exam.
No problem, Rick. It'll be over in no time. Okay, Rick, so how are you feeling?
Well, I feel a bit so bad. I guess I'll live.
Okay, so well, after the examination and we got the results back, I think that we should call your wife so she could be in here for this, okay?
Alright, brilliant.
Okay, doctor, what you were talking about just now?
Okay, well, I examined Rick and we found that his prostate was enlarged. And so we're just going to closely monitor his condition as it could be initial signs of prostate cancer.
What? Cancer? That means I didn't know. That means I should probably go to a funeral home one time.
No, don't worry. Doctor, it's not prostate cancer, right?
No, we still have several more tests just to confirm that it is indeed prostate cancer.
So, what you suggesting then?
Okay, well, I suggest that we just will closely monitor your condition and we'll probably perform more blood tests and just follow-ups.
Alright, so, I think I could manage with that, but yeah.
Okay, do you have any more questions?
No, I don't think so. But, one minor thing, like, when you say, follows, right? Like, how often should I visit?
Is once a month, okay?
Yeah, I think that's manageable. Alright, so I guess I'll see you for the next checkup, right?
Yep.
Alright, thanks.
No problem, take care.
Okay, doctor.
From the previous doctor-patient interaction, it is evident that Dr. Johnson is able to conduct a proper medical interview as he engaged with Rick by using non-verbal cues such as handshaking and maintaining eye contact. He also invited Rick to speak in a more private setting as opposed to in the corridor of the hospital. Dr. Johnson would also be able to relate to Rick's problem on a more personal level as he is male. He also included both open-ended and clarifying questions in order to obtain the information needed to make a diagnosis. He provided an outline of what would be discussed during the interview, summarized, and gave a concise explanation of the examination that needed to be performed, ensuring that Rick was comfortable with the management of his condition. Hence, it can be seen that the quality of communication between doctor and patient enhances the ability of a physician to make an accurate diagnosis and also aids in patient cooperation and satisfaction.